Hey guys, Dr. Wong here with Next Level Physiotherapy. Today I'm going to talk all about sciatica caused by disc herniations or disc bulges. One of the most common causes of sciatica is disc bulge or disc herniations. Before we get into the actual treatment, let's talk about what they are. So your spine consists of several bones stacked on top of each other. And in between each bone, you have this disc called an intervertebral disc. This disc comprises of two parts. So the middle of the disc is called nucleus pulposus. It's like a soft, gelatinous substance, and it moves when the spine moves. It's surrounded by a tough layer called annulus fibrosus. It's like a tough ring. Most doctors will describe the intervertebral disc like a jelly donut. The reason why they call it like a jelly donut is because it's firmer on the outside and softer on the inside. Obviously, the intervertebral disc is not as fragile, and it can handle pressures like compression, rotation, and bending. Throughout the course of a day, most people are sitting or bending forward a whole lot more than bending backwards, so that is why there's uneven stress on the actual spine. If you look at a jelly donut, as you bend forward, you add more compression forces to the front, so what happens is this can actually shift backwards and impinge the structures behind it, such as ligaments and nerves. Eventually, as time passes, if the person gets more sedentary and the core muscles get a little weaker, the disc can actually shift and jam into their nerves. When this happens, you get the numbness and tingling that shoots down the back of your leg, also known as sciatica. Doctors will describe this as sciatica due to disc herniations or disc bulge. Fortunately for you, there are many exercises out there that you're able to do to resolve this issue without needing medications, injections, or surgeries. In order to figure out which exercises works best for you, we have to talk about two concepts called centralization and peripheralization. When you have nerve peripheralization, what that means is you have symptoms of numbness and tingling shooting away from the source, which in your case is your low back. Centralization is the total opposite, where you have symptoms going towards the source, which is the low back. As we go through a sciatica home exercise program, you want to constantly check to see if your symptoms are going away from the source or going towards the source. And what you want to know is whatever you're doing that's causing the symptoms to go away from the source is actually making the situation worse. So you actually want centralization of the symptoms. If you feel an increase in your symptoms going away from the back, then you have to stop right away because that exercise is either not right for you right now or just too plain aggressive. So the first thing you want to do with sciatica is lie flat on your stomach on a firm surface. You want to do this for 15 seconds for 4 rounds. This position causes the spine to extend. If you feel the nerve symptoms going towards the low back, then that means you're moving in the right direction. The second position is a forearm prop, so you're going to keep the front of your hips on either your bed or your floor while you prop your upper body on your forearm. You're going to hold this for 15 seconds for 4 rounds. Once again, you only want to continue with this exercise if the symptoms are going towards your low back and not shooting down the back of your legs. The third progression is a full prone press up. What you do is you keep your hips on the bed or the floor, and then you can push your chest off the floor or the bed until your arms are straight. Perform this for 4 rounds of 15 seconds. The biggest mistakes I see people do with this position is they lift the hip up or move their butt towards their ankle. If you can tolerate the full prone press up, let's move on to the standing back extensions. You're going to stand and put your thumbs in your low back, and what you're going to do is keep your knees straight, and as you bend backwards, you can use your thumbs to push forward. Hold this position for 15 seconds for 4 rounds. Now that you know how to manage sciatica with disc bulge and herniations, let me know which of these exercises worked for you. Also, if you found these videos helpful, please consider subscribing so you don't miss out on our weekly videos. As always, move better, age stronger, and I'll see you next time.